Good to go here. Good morning, everyone. We were scheduled to do our regular weekly briefing today. However, shortly before the briefing, Dr. Morrison received a call about a positive case that has some potential broader implications. So we wanted to use this morning's briefing to provide as much information as we have at this time on the particular case. And we will continue to keep the public up to date as more information becomes available, whether that's through an additional briefing later today or tomorrow morning. But with that, I will turn it over to Dr. Morrison for the details, and we will later this week or early next week, we will resume our regular COVID briefing update. But for today, we will to talk about this particular situation. So over to you, Dr. Morrison.
Thank you, Premier. Good morning. So on this lovely spring day in PEI, we had, as the Premier mentioned, planned to give our regular briefing. But I think we'd like to focus on letting people know about that we have one new case, an individual in their 20s, identified just a little while ago, and contact tracing is underway. It does have the potential of having other implications because unfortunately the individual who is a case works at a daycare center. There are approximately 38 to 40 children at the daycare and 8 staff. The daycare has been in contact and is contacting the parents of the children, and they are closing the daycare and are sending all of them to be tested. And then they are going to go home and isolate. The family members are also being asked to go home and isolate until the test results of the child come back. We know this is certainly distressing for parents and families, and public health nursing and our office will be in touch with everyone who is on the list from the daycare. That includes the children and staff. And we will be contacting them with further guidance about as we learn more. The source of this case, it's likely travel related from what we understand at this point in time, but all close contacts of the case will be tested and will be followed up by public health nursing. And so all the other information we had about the cases in Atlantic Canada and vaccine, I think we'll leave for now, and we can do as part of a regular update. And we'll just let people know about this particular evolving situation. This now puts us at 7 active cases in PEI and 188 cases since the pandemic began. So maybe we'll just
and to all of our friends in the media, when we will do our best to take some questions, but and we'll provide as much information as we can. This information is very fresh, and as Dr. Morrison said, the Chief Public Health Office and all of our public health officials have sprung into action and are working quickly here. But we will provide as much information as we can based on that, and we'll be providing more information throughout the day as we learn more. So with that, I'll turn it over to questions from our friends in the media.
Wayne Thibodeau, CBC.
Good morning, Dr. Morrison. Can we begin by telling us where this daycare is?
The daycare is in Charlottetown. It's the Leaps and Bounds Leaps and Bounds Child Care Center.
Okay. And where is that located, sorry?
Charlottetown. And I believe it's on Hemlock Court.
And can you also talk to us a bit more about the source? You mentioned that the source is likely travel. Did this daycare worker travel, where they have a family member who's a rotational worker? Explain to us a bit more about the source, or the believed source anyway, of this case.
Well, we are really in the process of asking the questions and doing the contact tracing. But certainly from the initial conversation, it appears that someone who traveled may have been a close contact of this case.
Okay, thank you very much. And okay, thank you very much for your time.
Thank you.
Dave Stewart, The Guardian.
Good afternoon to you both. I guess, we're sort of pivoting on this information, wondering, is it too early to say, this could result in any new measures?
Hi, Dave. I think it's really too early at this point to say. I think it's our hope that, we're going to learn more in the next hours and day, but with the variants of concern now dominating much of what we're seeing across the country, and we've learned and we've seen what has happened in our neighboring provinces, how quickly things can spread, we really are going to need to be right now focus on trying to see if we can contain and manage any potential spread that may have happened in this situation.
And Dave, I would just add, if I could, that this is very early stages. We have tremendous public health staff who are good at doing this and are working diligently. And let's not forget that there are 38 to 40 kids and families and 8 staff members who are, this is difficult news for anybody to hear, in particular to them. So let's make sure our hearts go out to them and work with them to get through this. And we'll keep focused on what's important as we work through this. And if we have to make changes down the road, we've always taken that approach. But I think right now, let's let the professionals do their work and send our best wishes and keep in our thoughts those people who have received some potentially distressing news this morning.
Thank you. And I guess, a follow-up question, you may have spoken to it already. Do we know if it, and I guess maybe the investigation is going into whether it has been contained to the daycare and isn't in the community?
I think, Dave, it's too early at this point to say, and I think we'll know more after we test the contacts and the children. And it's unfortunate. This kind of case does remind people they should not go to work if they are not feeling well. And we have screening measures in place for a real good reason. We've been giving that advice all the way along. So I just take this as an opportunity to remind people.
Thanks very much. Appreciate it.
You're welcome.
Charlotte McCauley, The Eastern Graphic.
Hi, good morning. My question, I guess, is not really related to your announcement, if that's all right. My question is regarding the different regulations for the Madeline Island ferry entry point into PEI as compared to the other access points. And I'm just wondering, has there been any thought to bringing those regulations in line with the other access points with the tourism season coming up and the variants have kind of entered into the picture?
Well, I can start. Hi, Charlotte. So in terms of the Magdalen Island ferries, there are screeners in place for when people arrive from the Magdalen Island ferries. If they are staying in Prince Edward Island, they need to have a pre-approval travel letter, and if not, they are turned around. If they are driving directly through to New Brunswick or somewhere else, they are given a piece of an information and given advice about how they drive directly through and all of the public health measures that are in place here. That has been the case, and we continue to talk about these measures on an ongoing basis. with our, as part of our points of entry discussion. So they really are given, and we also have our enforcement, conservation, or highway safety, who are all doing some extra checks and they have a more presence up there when the ferries land. So that has been communicated to me as part of what is happening when the ferry arrives.
Okay, I guess as a follow-up, you mentioned enforcement. Are there any of the public health violations so far related to travel through this access point?
I'm not sure, but on that note, one of the things that we've talked about, and we're going to talk about with our Justice and Public Safety colleagues, almost putting out a weekly kind of, whether it's a release, although I have the numbers here myself, whether it's a bit of a weekly release on the charges that are in PEI and what they're for in terms of the public health, under the Public Health Act. So I think that may be something that will be something we'll do in the weeks ahead as well, which may be useful for people.
I think
Okay, thank you very much.
basically the point of entry's been consistent across the board, and if I think, we could provide those numbers to you, Charlotte, but I think of all of the points of entry, probably the least contentious from an enforcement issue has been the Magdalene Islands Ferry. But we can get that information and provide it to you.
Okay, thank you.
Thank you.
Carrie Campbell, CBC.
Hi, good afternoon. I just wondered, going back to these kids and their families, first of all, could you just clarify, so who's being told to isolate and what are the conditions for coming out of that? And just kind of generally, what are these children and their families being told to do right now?
Hi, Carrie. So literally the list of children and staff of the daycare are just arriving in the office. We were in touch with the daycare, and they were telling their parents, wanting to reach out to the parents directly and advise them to come and get their children and also be tested. And so and go home and isolate, and also household members go home and isolate until public health nursing gets a chance, and our office gets a chance to talk to them. And so partly what we're going to be looking at is, is there cohorting within the daycare? Is there mixing between different age groups? And some of that may determine who's close contact and who is not. So that is part of contact tracing that we'll be doing. But at this point in time, as so early on in the investigation, because it's always about risk assessment, but we are wanting to err on the side of caution, get everyone home, keep them isolated until we get the negative tests back on the children and on the staff, and we will be then asking the questions and giving each of these families the advice.
Anyone who needs to be contacted, or anyone that will need to be tested or require isolation or further health direction, will be contacted by public health. So that's important to note. I know when we've had incidents like this in the past, people, it's normal for people to become a little bit apprehensive, but anybody who needs to be tested immediately or who will require further isolation through the contact testing process will be contacted by public health, and that is what's taking place here yeah.
They will be reached this afternoon, so they will be working through all of this in the next few hours.
Okay, and I'm wondering, it sounds like you're still trying to determine what the safety protocols would have been that were in place, but I just wonder, because these are kids, it sounds like preschool kids, if you have any, sort of additional concerns, or if you think there's greater risk, because I think, any parent can tell you, you can only expect so much from, a toddler or whomever in terms of how they're going to be able to physically distance and things like that. How does that factor into how you look at this situation?
Well, I mean, I think we take each of these situations, Carrie, very seriously, and we ask all those kinds of questions. But we also know that children and young children seem, in terms of the numbers of cases of COVID, it's less common in some ways to have the spread amongst children than you do it amongst adults. So that I guess balances some of our thinking at this point in time. But right now, it doesn't change the fact that they all need to be tested. They need to isolate, and obviously, little children can't isolate by themselves. So that means a parent has to isolate with them, and there'll be certain circumstances where a household may have to isolate with that child. So those are the kinds of questions and the discussions we'll be having with the families about even the ability for one child and one parent to isolate away from others, and if that's even feasible.
And as a follow-up to that, Carrie, I have asked the Minister of Economic Growth, Tourism and Culture to arrange for a dedicated resource that individuals who are impacted here with this recent case can contact to assist them, whether it's accessing the federal supports which are available, but also then to look at what we could do as quickly as possible to make sure those who need to isolate and would require being away from work, for example, or need any assistance in the isolation process, to contact that resource. We'll make that number available shortly after lunch. But we want to do everything we can as quickly as we can to make sure this process is as simple and at least do the at least amount of impact to those who are dealing with this. So that number will be made available shortly.
If I could, just before you go, just one other thing. I know it's probably not just me wondering. The worker, do you know if they were following all the protocols, if they were tested, if they had negative results? I'm just wondering if, this was a case of those rules all being followed, but, this still getting through or what that situation is.
Carrie, I think it's still too early. Literally, these calls were being made just as we were coming down for this press, so I think it's too early.
I do appreciate your information on this. Thank you so much.
Thank you.
Marie-Ève, Radio-Canada.
Oui, bonjour. En fait, j'aimerais savoir, vous avez parlé là, tantôt que ça c'était likely travel related. J'aimerais avoir votre confirmation en français là, que l'enquête est toujours en cours pour savoir comment ce cas-là est arrivé à l'île du Prince-Édouard ou si c'est confirmé que c'est en lien avec le voyage.
Bonjour. Alors, c'est vraiment tôt dans l'investigation et de santé publique, mais ça a l'air comme il y avait quelqu'un qui a voyagé hors de les provinces atlantiques, qui était un contact proche de ce nouveau cas.
Merci. J'aurais aussi une relance. Si vous pouviez répéter en français exactement qu'est-ce qui va être demandé cet après-midi aux enfants et aux familles des enfants qui doivent s'isoler et se faire dépister, s'il vous plaît.
Alors, on demande aux enfants et les familles de vraiment retourner chez eux pour isoler. Et on demande aux enfants et les personnes les travailleurs qui travaillent au Child Care Center d'être testés. C'est pas tout le monde d'être testé. On commence avec les enfants qui sont là et puis les personnes qui travaillent là-bas. Et puis après ça, les infirmières sur mon équipe et avec Santé publique, on va avoir plus de discussions avec les familles pour déterminer qui doit isoler pour un plus grand bout de temps et s'il peut isoler juste comme maman et enfant ou si c'est toute la famille. Et ça, des fois, va dépendre vraiment où ils habitent, les détails comme ça.
Et dernière petite question par rapport à ça, est-ce que les infirmières de la santé publique vont appeler les gens et discuter un à un avec ces familles-là?
On va avoir les infirmières cet après-midi qui vont appeler les 38 à 40 enfants, plus en addition les personnes avec qui travaillent là-bas et puis les autres contacts proches. Alors, on vient de recevoir la liste des enfants et les familles et on sont en train de commencer à faire les appels. Alors, ça va être cet après-midi, on va essayer de contacter toutes les personnes sur la liste.
Merci.
So I think that brings to an end. I would just add at the end, if I could, that we recognize that this isn't the news that we like to hear, but we've been through difficult times before. As Dr. Morrison and I talked about before we came here, we have the best, most professional staff at work. They're acting quickly. We will learn more in the hours ahead, and we will share that with Islanders as we learn it. And as we do, if we need to come back later today, we will do that. But until then, stay safe and keep everyone in your thoughts. Thank you very much. Thank you.